Hi, and welcome to our webinar on Review and Republish Your Data Security and Protection Toolkit. We will just give it a couple of minutes just to allow everybody to join, and then we'll get started. But thank you for joining us. Okay, I think we'll get started now. Um, welcome to the webinar on Review and Republish Your Data Security and Protection Toolkit. I'm Angie McNally. I'm one of the local support personnel that deal with DSPT, and I look after the Bob region, so Berkshire, Oxfordshire and Buckinghamshire, on behalf of the Better Security, Better Care programme. And the next slide. So just a few technical issues here. This is for care providers who've already published their DSPT in the past. Attendees are on mute and can't be seen. Please use the question and answer function to ask any questions. Oh, somebody's saying that they can't hear anything. I'll carry on and I'll leave Rhiannon and Cyrus to sort that out. On a phone, tap the screen to see the controls and choose more, and then choose question and answers. Questions that we can't answer will come back to you. We will come back to you. So add your email to the questions and answers. This webinar will last no longer than 1 hour, and you will get access to the presentation, including the links, later after the webinar. And going to the next slide, lovely. So we're just going to do a slight poll. So if you could just answer the questions as what level is your organisation currently at on the DSPT? Have you personally used the DSPT before? Are you a single site, or are you a multi-site organisation with a head office and various sites? And where did you hear about this webinar? So I'll just give it a few minutes for those to start coming through. How's that going? Yeah. If you happy, then just take it down. That's lovely. Thank you. Oh yeah, that's quite good. Yeah. So there's quite a lot of you at standards met. There's a few at approaching standards, and even some at standards exceeded. And some of you have heard about the DSPT, quite a few actually, so that's fantastic. Okay, if you're happy to go on, we'll go on to the next slide, please. Okay, so today's agenda is we're going to look at logging into your DSPT, reviewing your DSPT, looking at what's changed and how to republish your DSPT. We'll give you some tips and give you some support that's available out there, and we'll answer any questions, and then we'll give you the next steps once you've published. So if we go to the next slide. Okay, so because you've completed it before, you're more than halfway there. So it's just a case of logging in, reviewing and updating your answers. Make sure all the mandatory questions are published or completed, sorry, and then published by the 30th of June. So you've got 13 days. And you must keep your DSPT up to date. It's a live document, so if anything changes, you must change the information on your DSPT. So if you've got any policy changes, and you should republish at least once a year. Go to the next slide. So you're not alone. There's lots of people out there in the same boat, and the Better Security, Better Care team have lots of free and official advice. There's online guidance, webinars, templates, a helpline, and as I said before, tailored support from 20 local support partners across England. And you can find all that on the Digital Care Hub website. The link's there. So to log into your DSPT, you would go to the www.DSPT Toolkit and you log in with your email and password. If you've got any problems in logging in, so if it wasn't you that completed it yourself last time and that person may have left and you don't have the password, you're not the registered person, then you would need to contact our help desk. So you can contact them by the phone number there or by exeterhelpdesk@nhs.net. Okay. This is what you see when you log in. So you'll see you enter your email address and then you would enter your password and then you would press login. There's a facility there if you've forgotten your password, but and if you don't have an account, you may need to register. Okay, and the next slide. Okay, and then once you've opened it, you will see the assessment and it will say complete your assessment. And for this year, it'll say 24-25. And it'll show you the progress. So it'll show you 13 of how many mandatory evidence items are provided. Okay, so you've still got a few to complete. There's 43 mandatory questions and they're grouped in 4 sections. And this will be a single site assessment view. Look, so for those using ODS code V that starts with a V. Okay, and the next one. And this is what it would look like if you were completing for a headquarters assessment. So this would be if you were using an A code to complete. So you'll have a different screen heading and you can view all your branches here. And when you publish, you can choose which of your sites you're publishing for as a multi-site provider and can publish just one DSPT to cover all the location and branches as long as your policies and procedures are the same across the board. Okay, next slide. What you will need to do will depend on what you did first, okay? So if you're at approaching standards, which I noticed some people on the poll said they were, you will need to review and update your answers. You will also have to complete the remaining mandatory questions to reach standards met. So for approaching standards, you would have completed 26 questions, but as we said before, there's 43 questions, so you would have to complete the however many it is, 17, 18. And you cannot publish to approaching standards again. You should have, when you published to approaching standards, you should have downloaded what's the word I'm looking for? A report to help you work on for the next year. So you could have that in place and your answers may be there if you've been working on it. If your standards met, you need to review and update existing answers. So that means that you might have to confirm that these are correct, or you may have to update if there's anything changed. And the same goes for standards exceeded. So you would review and update existing answers. So you would see your answers from last year and you would react accordingly, whether that's a review and confirm or an update. Okay, next slide. So as I said, your previous answers are still there. It may look a little bit different from what you've seen before. So don't panic. As I said, it may say confirmation needed. So you would have to tick that. The assessment view includes all the DSPT questions. And please, you only have to answer the mandatory ones, okay? So the DSPT is a toolkit that covers lots and lots of different organisations and categories. So it may cover pharmacies, dentists, GPs. So their questions might be slightly different. So when you have logged on and registered for the first time, you will have chosen social care. So then it brings up the mandatory questions appropriate for social care and you only need to answer those. Okay, and the next slide. So changes to the DSPT. There's been a few changes since last year, but not many, so we don't tend to. So introduced last year, we have the multi-site publishing change. So in addition to the screen when publishing, displayed organisations not flagged as HQ, but previously published on behalf of other sites. So if I've got a few that publish for their sister sites. So one person in the organisation takes control of the DSPT because they have the same policies and procedures, but it may not be a head office, it may be a sister site. So you would see this and it would ask you who you'd like to publish for. The existing functionality with the headquarters and sites is unchanged. When a non-headquarter organisation that had sites added to their last publication published assessment, the additional screen below will be shown. So as I said, if it's a sister site, it will show those and you can click on the ones that you are happy to publish. The next slide. So we've got new mandatory question, so multi-factor authentication, can't say it, MFA, and that's 4.53. So MFA is one of the most effective ways to protect data and accounts from unauthorised access. You should consider all systems that can be accessed from the internet, such as email, digital social care records, any cloud-based or online systems, and either ensure that all users are protected by MFA or detail any exceptions in the text box response. So there's guidance on that on the digital care website, and when you get the slides, the links there, so you can just click on that. The next slide. Okay, so MFA is a way of making your online accounts much safer by adding extra steps to prove it's really you trying to log on. And it's usually either a text message, an email code, a fingerprint, or an authenticator app, such as Microsoft. Okay, and you've probably all done this before if you've used online banking or even logging into your social media accounts. Most accounts nowadays are asking for some kind of multi-factor authentication. Got it? And it ensures we keep everything safe, okay? And it will give you maybe a code, like I said, that you see on the screen there, or it might ask for facial recognition, or that one asks for blink your eyes to confirm it's you. So, yeah, so you would have that. So next slide then, Cyrus, thank you. So the steps to take: review your current systems and speak to your suppliers. Identify any potential issues, e.g. staff sharing devices or logins. Identify when implementing MFA might not be appropriate. So if there's already other significant controls in place. Decide on your organisation's balance of security versus usability. And note any systems without MFA at a director or board level and why you've chosen not to do them. So it's really important that you don't just put security above usability, because we find that people will find ways around it and it becomes even more unsafe. So you've got to look at it and decide if it would be appropriate for you to use MFA and it doesn't stop the usability of that function or that program that you're using. So important not to go overboard. As I said, systems must be usable. And if you add too many layers, people will either stop using existing systems or find workarounds, as I said. Identify the appropriate level of security for each system you use based on the sensitivity of information, the usability and your appetite for risk as an organisation. And where appropriate, MFA should be implemented for all individual logons to the system. Use the support available, so contact one of your local support organisation, software suppliers or IT suppliers. They'll be able to help you. And there is guidance, as I said. So if we get on to republishing your DSPT. So as we said, you log in and then you review and update the existing answers and make sure all mandatory questions are complete. And you must publish by the 30th of June. So only answer the mandatory questions, and you can see down the side they're clearly marked. You may leave all the other questions blank. To delve deeper into the questions, if you click on the blue writing, the evidence item, you'll see the questions and you'll see a tooltip, so it'll give you some kind of advice there. It may give you a link to go to the digital Digital Care Hub website. Review and update your existing answers. So if anything's changed, you must note that down. You know, if your data protection officer's changed, anything along those lines has changed, then you must note that down and update existing answers. And then make sure you look at the answer when you're answering, because some are a tick box, some are a tick box and a yellow comments box, some are click on blue writing and download something. So make sure. So on this one, it shows you here. This one's a tick box. It shows you the question. This is an example of 4.1.1. It gives you the toolkit to give you best practice advice, i.e. what you must do. And then there's a comments box. Now, sometimes it's optional and sometimes it's mandatory. If it's coloured in yellow, then it's mandatory. When it's optional, it's really, really useful to put in any information that would help your colleagues in future publications. But it also may help if you get a visit from CQC or your local authority and they wish to view your DSPT or view aspects of it. Because when you register your DSPT, you can, at any point, you can add people. So there's 3 categories. You can have a view only. So like if CQC came in, you could give them a view only aspect. You could have update but not publish, or you can have publish. So you can delegate parts of it to other parts. So if you've got the IT questions, could go to the IT department. Your training questions could go to your training department. Or you might delegate it to your heads of service or your data security protection leads, whatever. So there's various options, so you don't have to do it on your own. And that's where the comments come in, very useful, and they'll prove useful for next year as well, because you may have ticked something and then think, oh, I'll remember that. But when you come back to it the following year, you may think, well, I'm not really sure what that was about. So any comments you can put can help you on that journey. And the next slide. Okay, so this is an example of a response to question 4.1. So does your organisation have an up-to-date record of staff and volunteers, if you have them, and their roles? And the answer is yes, but they've put the comments in. So staff and volunteers registered are contained in HR files, both hard copies and electronic versions, which are saved on both the Google Drive and Portable D Drive in the Operations Director's office. The hard copies are kept in a locked drawer. So nice and clear, tells you exactly where everything's saved, so that if somebody new came along, they would be able to go and check that they're still in that same place, but they would know where to find them and how you've answered it the previous year. Okay. And now, once you've completed all the mandatory questions, okay, you would go on to publish. Okay, as we said before, you must keep it up to date and you must republish at least once a year. And the deadline for everybody, regardless of when you publish, is the 30th of June. So it rolls into the next year after the 30th of June. So you must publish to be compliant by the 30th of June. Okay, and so when you've completed all the mandatory questions, at the bottom of your assessment toolkit, you'll see Publish Assessment. You click on Publish Assessment, but remember your DSPT will not be published. It's not. It's only your the status. So it'll say DSPT standards met. That's all that anybody else can see unless you've given them access to it. Okay, so it's not your full report, so you're not giving anything away. That is only for your eyes. Okay, so you press the Publish Assessment, and then on the next slide. If everything is okay, if your headquarters publish for all sites, you would view your branches here, confirm that they've got the same policies, procedures, IT system and data security arrangements. And then if yes, you can publish one DSPT for all sites, which is really handy if you've got, more than 2 or 3 sites. It saves your registered managers doing it individually, but it's also a great benefit if you can involve your register managers in it and let them know that you've published your DSPT, and also filter down aspects of the DSPT to your staff, so training, all the things that are to go with data and cybersecurity, okay? But much easier to just publish one headquarters and then filter that down rather than multiple assessments. Okay, for the next slide. If there was anything incomplete, you'd maybe miss something off. And what we usually find is people think they've answered a question, but they haven't either ticked a box or filled in the yellow comments or clicked on the blue writing that may say enter text here or download a copy of something here. So make sure you read the questions clearly. But if there's any problems, it comes up like this in red and it tells you exactly which questions you need to answer or you need to go back and check. Okay. And the next one. Once you've published, you'll get a publication notification looking something like this, and it'll be a confirmation of your publication of your assessment. It'll show you status, standards met, and it'll tell you that it's publicly available for other service users, commissioners and partner organisations and the public. And they can view that, or you can view it at the DSPT portal organisation search. Again, the link is there. Okay. And just some useful tips to help you on your way. Okay, so I've talked about this. So as I said, you can give somebody access to the DSPT and there's 3 levels. So you can give them a view only. So that might be, you might have answered some questions, but you want your IT department to have a look at it. So you let them have access to look at it only. Or if they can be a member, so they can look at it and they can add or edit evidence. But the administrator is the only one that can manage users, add and edit evidence, confirm evidence, and publish. Okay, so the main administrator is the only person that can do that, but the others can be involved. So don't think you have to do it on your own in your organisation, and you don't have to do it on your own out of your organisation because we're here to help. Okay, and the next slide. Okay, so once you've published your DSPT, there's a couple of ways you can export or download your assessment. And so this one is export your assessment to Excel. So you would click on the download, so download assessment, and the Excel file will download into your device straight away, nice and easy, and then you can save it to your relevant, wherever you want to store it. Okay, so that's another thing that, and then if you do that as a multi-site, you can then copy that and pass it down to your registered managers, which is a good thing to do. If you want to save it as a PDF, so you go to view your previous publications, view details, save as PDF, and if you've published the standards met, you can download a certificate. Again, it's great to do that. You can put it on your website. If you're a multi-site, it's good to take copies of it and give it to your registered managers. And this is roughly what your, this is your saved your published DSPT as a PDF. So it will come up like this, Control and P to save as a PDF, or click on Save there. So it's usually quite straightforward, and just follow the instructions. And make the most of your DSPT. So, as I said, once you've published your DSPT and you've got your certificate, make sure you tell all your branches, tell your registered managers, download the certificate to prove you've got it, and put that certificate on your website or your privacy statement, or consider adding a link to the DSPT status. Include it in all your bids because it shows that you're taking data and cybersecurity seriously. Make sure you tell your commissioners, because we're finding more and more that local authorities are now not only recognising the DSPT, but it's becoming part of their contract negotiations. Also include any ICSs or ICBs that you have. Tell your NHS partners and tell your IT suppliers that they know that you're keeping everything up and secure. But it's also good to tell your clients and your staff, because again, it's their data that you'll be looking after. So to make it real, keep your DSPT up to date throughout the year. It's easier to republish So it saves you going and answering 43 questions. If something has changed during the year, just go in and update it, and then, you know, it's just a case of answering a few more questions. Ensure managers and staff understand what is expected of them. So we're looking at now not just publishing your DSPT, but embedding that culture within your organisation. So bringing your managers and your staff on board, you know, making sure they're aware of the policies, where the policies are kept, make sure they're aware of your business continuity plan and what to do in case of a breach, have set procedures there in place. So ensure managers have access to the information. So as I said, consider a printout of the documents, or you could just send it via link, and related policies and procedures in a manual. Again, this is useful for CQC. So I have a few of my providers that print out their assessment, and then for each question, they've got another slot behind, and they've got the relevant policies and procedures in there, so that if CQC came in, or the local authority, they could just, instead of giving them view only, they can just hand over a file, and then everything is there. But it doesn't, you don't have to do that, but it just proves, some people have found it proves easier to do this. But it is a good tip there. And then the next slide. Okay, so as we said at the beginning, there's free expert support from the Better Security Better team and the 28 local support partners across England. So on the website, there's free and official guidance, online guidance and step-by-step films. There's also webinars and recording of webinars there. So if there's any questions or that you might think of, like regarding your business continuity plan for reason, that there's webinars on there looking at that. There's frequently asked questions. So somebody else may have thought of the question that you have, and there may be an answer there. There's lots and lots of template policies. So they don't have to be exact, but you want to make sure that they're covering everything that's included in those template policies. There's a helpline as well, so you can phone our helpline, which the number was earlier on the webinar. And as I said, you can contact your local support partner, and you can find them on the website. Okay, and the next slide. Okay, so this is just some of the template policies that are available on the website. So, and also to make sure that you've got everything in place. So for approaching standards, you would have had to have how to document your data processing, including template information asset register and record of processing activities. And that's quite a biggie, but you've all done that if you're reviewing and republishing. It may be just a case of overlooking it and making sure it's up to date. You've got privacy notice template, a data protection policy, data quality policy template, and the list goes on. And then for standards met, you will need an additional requirement for a few other policies, not many, but there's a training needs analysis. And again, that you can download from the website, a data security audit checklist, creating and testing a business continuity plan. So this is really important. You must look at the worst case scenarios of what would happen if there was a cyber incident, or if you were, somebody had clicked on a phishing email, and what you needed to do. So you should have these scenarios in place. Your registered managers and staff should be aware of them, and you should test them throughout the year and note that that you're testing them, and note the outcomes and reflect on those. And there's also the national data opt-out, where people can opt out of you sharing their data. And there's some recommended documentation. So there's data security breach incident reporting form. So you can have that in place with your business continuity plan. Mobile devices assignment forms, there's a template for that. There's a smartphone policy template. So organisation provides phones, and there's a template for suppliers list. So again, the suppliers list is really important, because we're finding that if there is a cyber security breach, it can come down the supplier chain. So it's good to know who your suppliers are. It's also good to be able to contact them should you have a cyber breach. The next one. So as I said, further guidance on the digital care So it's split into areas there. So you've got staff and workforce, and what so there's skills and training on there, the staff guidance. You've got IT and software suppliers. So there's guidance on managing software suppliers who process personal data. Document retention and disposal. This is one that comes up again and again. People will have said that it's mandatory 6 years, but each different piece of data, unfortunately, has different length, life length. So you need to have a look at the documentation on that. And there's advice on contracts for third party, for secure disposal of personal data. How to improve your security. So talking about strong passwords, so you could use that in your managers' meetings. Guidance on anti-virus software, guidance on backup. So again, that's another place that we're finding a lot of people are maybe outsource this to their IT department or IT supplier, but you must make sure that you know that they're doing it, and you must be able to test it now and again to make sure that it is happening and that it's all there, because what you don't want to find is that you lose access to your systems and you haven't got a backup there. So make sure you've talked to your IT supplier about that and make sure you're testing it. Guidance on software updates. There's protecting mobile phones and tablets, and obviously guidance on the national data opt-out. And if you need any of those, contact the Better Security, Better Care local support partner, and that's the link there, or visit the Digital Care website. So the 28 local support partners can offer you various forms of help. So we can do one-to-one, and that can be via Teams or on Zoom call, or it can be face-to-face, or we can do small group support. We can help you answer the questions, even if it's just one question you're stuck on, or the 43 questions, it doesn't matter, we're here to help. We can help you publish, and we can keep connected we keep connected to the local authority and NHS digital leads. So we keep them updated on where we are, how many people have published, so forth. So as I said, you can contact us through the Better Security, Better Care or Digital Care Hub website, and remember, it's free. So it's free at the minute still. So anything you ask us, any time that we spend with you, is completely free. It doesn't cost you a penny. So please use us. That's what we're there for. If you're one of the large care provider groups, so if you're one of the market oversight providers, you can contact the Digital Care Hub helpline, or even if you're just a multi-site organisation, you can contact the helpline for advice and support. We do have a dedicated team looking after them, and they will put you in contact with them. If there's any technical issues, then please contact the helpline. So if you can't log in for any reason, somebody's left and you haven't got the password and you haven't got the login details, then please contact the helpline or anything else that's technical. And so the next steps are for you is check out the guidance on the Digital Care Hub, contact your local support partner, and the details are all here. And make sure you're looking at the social media, because we do put out if there's national webinars coming up that may be of interest, that may be relevant for the DSPT. So there's various ones that they do. So they do like business continuity. They're doing one where it's a hacker versus the police. That's coming up soon. So watch out for that. That'll be really interesting, where you can see live coverage of a hacking incident going on. But keep an eye on these things, because there may be something of interest that comes up, and again, it's all free to register for. And if there's any questions or any final questions.
Yes, we do have one question.
Yeah.
They said, is it okay if we publish multiple DSPTs for our different branches, or do they have to make sure that all logs are put together?
No, it's fine, and especially if they run their own policies and procedures, or they've got a separate IT system. So we find that some franchise companies have They may have the same policies and procedures, but they may have different IT systems. So then you would publish. It's fine. The only reason it's there is for ease for the for anybody that has got the same policies, procedures, IT systems in place. Then they can publish as one. It can make life easier. But as we said, you know, to include the register manager at each site is a great benefit.
Amazing. Thanks so much, Angie. And that's all of the questions.
Okay, that's great. And we've just got a poll just before you leave us. Looking at what's the impact of your confidence with reviewing and republishing? How likely is it you will complete your DSPT for the next 3 months? How likely, I can't see that now. Just let me move it out the way. How likely is it that you will contact your local support partner? And would you recommend this webinar to a colleague? Just if you can, that would be great. Just take a couple of seconds to fill that in. But please don't think any question is too small. I mean, that's what the local support partners are there for. You know, we're there to help. And if we can't help, they'll go, you know, we've got the backing of the national team and they've got the backing of lots of other people, and we can go elsewhere and look. So, you know, don't be frightened to ask any digital or data security question. And don't be scared when you first look on and you see the 43 questions. When you actually sit down and look at them individually, it's not as bad as you think. I know exactly how you feel when looking at looking at it for the first time. Okay, so some really good feedback there. There's lots of people likely to complete and publish their DSPT. That's fantastic. We've helped increase confidence, so that's really good. But please remember, as I said, you're not alone. There's plenty of help out there. And thank you. And the slides will be sent to everybody shortly after the webinar. So thank you again, and goodbye.
Thanks so much, Angie.
No problem. Thank you. Bye.